A little poke might be just what the doctor has ordered to cure the United States of a once eradicated disease called the mumps and measles. Yet two problems stand in the path of our cure. One, low vaccination rates, and two, a lack of communication between doctors and patients. After numerous medical scares, the significant drop in vaccination rates has allowed diseases to re-enter the United States and spread like wildfire. As a parent, it is important that you can find the truth and protect your child. I've compared multiple news articles and reports from across the nation to provide a well-rounded analysis of our current media coverage. Prior to discussing fake news, we must first cover the background information and events leading up to the present-day situation. Then we will discuss news articles and coverage and language that has restricted details and how it influenced our perception of our outbreak. So what exactly is the mumps and measles virus? Measles is a childhood disease that affects children and young adults. However, adults with a weakened immune system or elderly are also susceptible to catching it. Infected individuals have things such as fever, cough, skin rash, runny nose, and other symptoms. It lasts 2 to 3 weeks and is highly contagious 4 days prior and post-rash, according to the CDC. Luckily for us, there is a cure, and it's called a preventative, a vaccination. The MMR, mumps and measles, and rubella vaccine gives full immunity against the virus. The vaccine was created in 1967 and led to the eradication of the virus shortly after in 2000 in the United States. The Center for Disease Control and Preventative stated, "Vaccines are widely misunderstood by the general public due to our lack of understanding," staff writer Michael Schreider explained in his article titled "Vaccines for Kids, Adults." With a disease that is preventable via vaccination, why are we experiencing such mixed messages about the safety of our immunizations? To begin, the news coverage broke on March 6, 2019, following an anti-vaccine movement in the Senate. It was aired on Fox News Channel, and the panel discussed limited communication between health professionals and parents with the benefits and risks of vaccination. Fox News 2019. CNN then chose to follow suit, publishing an article by Guthrie about the 2 viral outbreaks plaguing our country. He stated that the 2 outbreaks are more than 800 cases of the measles, and the second is a plague of misinformation, Guthrie 2019. Furthermore, CNN states that we need 93 to 95% of our population to be vaccinated in order to prevent outbreaks with our weakened immunity, general public. Finally, he closed his argument stating the MMR vaccination is neither dangerous and it doesn't cause sickness or an increase in autism. An anti-vaxxer rally was covered by the Washington Post on June 5, 2019. The article cited people of both pro and anti-vaccination standing, allowing for multiple viewpoints to be discovered. Del Bigtree was recorded saying they should have allowed measles if they want measles. Gunther and Son. Countering the rally, the local health commissioner of New York said New Yorkers are being put at risk by the spread of misinformation, including children who are too young to be vaccinated, or those who have medical conditions that make vaccination impossible. Gunnar and Son, 2019. In an effort to combat this problem, New York has implemented summons up to $1,000 and have began putting up propaganda to educate parents on the benefits of being pro-vaccination. The articles published by U.S. News and CDC proved rather informative, discussing recent rise in measles without focusing on the politics of it. They referred to evidence of vaccine suggestions, and current outbreak numbers. While all articles presented information on vaccines and viruses, each was riddled with differing facts, viewpoints, and opinions. Biases and fake news were used in all of the articles I researched in order to change the perception of the audience. A prime example of bias is the introduction of a reporter's opinion into the news articles that they have written. In every article, some form of bias was present, usually in the form of being pro-vaccination. The article by CNN was reported saying plague, fake news, and misinformation, along with facts only supporting the pro-vaccination stance. He concluded his article by saying, "I urge parents to get the right information and vaccinate their children." Guthrie, 2019. Whereas U.S. News and the CDC reporters chose to give only facts to the audience, including infographics, public health surveys, and information on the local outbreaks. The CDC's report was overall the least biased of all articles and compared breakouts throughout the years rather than focusing on only this year's big outbreak. And did not point blame like CNN, Fox, Washington, and U.S. News. An overall theme in the articles was published in CNN, Fox, and the Washington Post, labeling the parents that aren't comfortable with vaccinating their children as an anti-vaxxer. These authors also exhibited biases, though, through the officials they chose to quote and the continual blame of those who are unvaccinated on our current situation. In conclusion, news has a tendency to contain biases, whether subtle or boldly demonstrated, and we must be careful to double-check our facts before deciding what to do and who to believe. Whether or not the doctor ordered it, you have the right and the ultimate power to decide whether or not to vaccinate your children, and be sure to communicate with your child's healthcare provider before making the choice. Thank you.